Hello, my name is Angela Wicker-Ramos, and I'm the certified lymphedema therapist and oncology rehab specialist at Cancer Rehab and Integrative Medicine. I'm very excited to start off this symposium today with an introduction or a presentation specifically on your lymphatic system. What is your lymphatic system, the function of your lymphatic system, how your lymphatic system can be injured and impaired, as well as treatment if there is an issue with your lymphatics. And why it's important for us to start with this introduction of your lymphatic system is because the rest of this symposium is going to be about an integrative approach to lymphatic health. So we need to have a very good foundation of knowledge in terms of your lymphatic system in order to understand the other presentations and to get the greatest benefit out of the other presentations in looking at your lymphatic system as a whole system and finding an integrative approach to maintaining lymphatic health. So let's start off with a discussion on what is your lymphatic system. Your lymphatic system, I like to say it is a very underrepresented system of the body. We do not generally hear much about it until there's an issue with it. Your lymphatic system is like the middleman between your circulatory system and your immune system. So it has function in both circulation as well as immunity. Your lymphatic system, first of all, one of its main jobs is to remove waste and to deliver nutrients to your cells. So imagine you always have fluid that's intermingling and moving within your tissue spaces, and it's bringing nutrients to your cells, bringing your cells what they need, and then your cells are dumping what they don't need. Sometimes people say waste, but there's more than just that moves into the lymphatic fluid between the tissue spaces. Then that fluid eventually gets absorbed into the lymphatic vessels, gets filtered through your lymph nodes, and then moves into your circulatory system. So again, imagining that lymphatic system is the middleman helping transport that fluid. Also producing white blood cells, lymphocytes, to help you fight infection and fight disease. So looking at this diagram here, this is a lymph node. The lymph node has these lymphatic vessels popping out of it right here. So you imagine like a spider's body and these spider legs coming out of it. The lymph node itself is a filtration, filtering out toxins. And then looking at this diagram here, everything that you see that looks like these highway systems right here are the lymphatic vessels. They're these right here coming out of these lymph nodes and moving fluid through your body. You have groups of lymph nodes throughout your entire system. And I'm going to speak about that a little bit further in the next slide. So remembering that your lymphatic system is the middleman between your immune system and your circulatory system, and it's picking up fluid as well as particles. And what are these particles that make up this lymphatic load or make up this lymphatic fluid? We have water, clearly. But we also have other things because it is a transportation system. We have protein, we have white blood cells, we have long chain fatty acids. And again, those lymph nodes are a filtration system as well. So here's a more detailed diagram of your lymphatic system, and go ahead and see that, look, it's like an entire net throughout your entire body here. You have groups of lymph nodes throughout your head, your neck, your armpits, your deep abdominal area, your pelvic area, and even a few right behind your knee here. So truly, it is moving fluid through your entire body. It is almost everywhere in your entire body. Now you have regional lymph nodes, meaning there are groups of lymph nodes that are in charge of certain areas of your body. And those lymph nodes are very specific to the area of the body that they're trying to drain fluid from, or that they are draining fluid from. You have regional lymph nodes in the head and neck. You have over 300. There are many, many lymph nodes in the head and neck area. The lymph nodes in the head and neck area drain fluid from what you would imagine from the head and the neck, right? So draining fluid from this area down. You also have lymph nodes in the inguinal area, which is your pelvic area. These lymph nodes, right in here, drain fluid from the pelvic area from the lower abdominal area, and from the legs. Now, the reason this is important is when we talk about lymphatic damage, we need to be remembering which lymph nodes perhaps have been damaged and how that's going to impact the area where they drain fluid, right? So these inguinal lymph nodes or these pelvic lymph nodes are only in charge of this region. Other groups of regional lymph nodes, we have axillary lymph nodes. So those are in the armpit area. Those are the ones that are most likely impacted by breast cancer treatment. And so those lymph nodes are in charge of draining fluid from the arm on that side, from the chest on that side, as well as the upper back on that side. Okay, so there's very clear delineation as to these group of lymph nodes and their jobs. So your lymphatic system has the nodes, it's got the vessels, and then it's also got what we call a thoracic duct. The thoracic duct is a real large highway system that brings your lymphatic fluid from the lower body all the way up to dump it into your veins. So if we go back to this picture right here, this is your thoracic duct. For those of you in Austin, Texas, I like to say this is the I-35 of your lymphatic system. It is the largest highway system that's transporting all of that lymphatic fluid up, and it's dumping it into a group of veins right here above your collarbone. This group of veins is where the lymphatic fluid dumps into, and then now it's part of your circulatory system. It dumps into those veins. Now, one of the reasons why I'm talking about that thoracic duct and really, spending a lot of time on it is because we're going to be talking about deep breathing kind of throughout this entire symposium. And one of the reasons for that is because deep abdominal breathing or diaphragmatic breathing stimulates that thoracic duct and stimulates lymphatic circulation. All right, so in terms of your lymphatics, where does it start, right? It's super superficial. So your lymphatic system, if you imagine that this is your hair, this is your skin, there's the hair on your skin, there's that superficial layer. And so here we're looking at fat, your fat right here, and then we've got your veins and your arteries, and then these are your hair follicles right here. This in green are your lymphatics. So you can see how they're kind of distributed throughout the tissues here, pretty superficial. And these are those initial lymphatics that are picking up the fluid and moving it deeper into your lymphatics. So now if we look at it from even closer here, this is your lymphatic vessel, and see how it has these little valves here. And so the intention is, as fluid's going in there, we're hoping that those valves will help direct the fluid and move it. But with your lymphatic system, unlike your circulatory system, your heart is not the pump that moves lymphatic fluid through your body. Unfortunately, your heart is not helping move lymphatic fluid. What is helping move your lymphatic fluid is your skeletal muscles, which are your large muscles that when you actively move your body, those skeletal muscles are contracting and relaxing. That will be very important through our seminar and symposium today as well. And I also like this picture here because it is showing this area right here, this venous angle, or what I said was the ending point of your lymphatic system as well. So it's showing the green here is your lymphatic vessels that are dumping fluid into these veins right here. Lymphatics in action. Have you wanted to see your lymphatics actually work in real time in an image? I am going to show that to you here. So this is pretty incredible. So this is what we call ICG, or indocyanine green lymphography. And it is a way of inserting a very benign dye into the lymphatic system and then using vision that's similar to nighttime goggle vision to actually see the lymphatics in real time. And so here we go with observing this. So this is her hand, and you can see that lymphatic fluid moving up the arm. Those are lymphatic vessels moving that fluid up. Pretty incredible to see that. So, how do we stimulate really good lymphatic flow? We really rely on our skeletal muscles to move that lymphatic fluid through your system. This is a picture of those lymphatic vessels, and there's all of the protein in the cell fragments and all of the fluid, the lymphatic load moving through those vessels. These are your skeletal muscles throughout your body, your biceps, your leg muscles, your hamstrings, your quadriceps, all of those main muscle groups, by contracting and relaxing, are helping push that fluid up. So what does that mean? That means the more sedentary we are, the more stationary we are, the less likely that lymphatic fluid is going to be able to move effectively through your lymphatic system. Easy ways to promote lymphatic health. I'm really going to brush through this because we're going to get into this in greater detail throughout our symposium today with our actual yoga classes and with our presenters, including our dietitian and our counselor, as well as our yoga instructors. But I just want to let you guys know, when we're talking about anatomy and function, understanding that deep breathing, again, because of that thoracic duct, also exercise because of that muscle pump. Hydration is important. So people who have a damaged lymphatic system and ultimately end up with swelling, it can seem counterintuitive where you think, I don't want to drink too much fluid because my body is retaining fluid. That's absolutely incorrect. You need to stay well hydrated to help with that lymphatic circulation. Our dietitian in her presentation today is going to talk in greater detail about hydration and how that impacts the lymphatic system. And then maintaining a healthy diet. Again, this will be discussed in our nutrition seminar, but it is very important for the lymphatic system as well. Understanding signs of lymphedema. If we look at the word lymphedema, lymph, the front of this word, means lymphatics. Edema is just a medical term for swelling. So edema is actually a symptom, right? You can have swelling because you stubbed your toe, you can have swelling because you had surgery, or you can have swelling because your lymphatic system is injured. And that type of swelling, where the actual fluid that's creating the swelling is lymphatic, is called lymphedema. How or why do people get lymphedema? There's many reasons. It can be something that someone is born with. Sometimes people are born with an abnormal lymphatic system. The lymphatic system was overdeveloped, underdeveloped. Sometimes lymphedema can happen because someone has had chronic swelling for years, or they've been having issues with cardiac issues, pulmonary issues. So it can be something that accumulates over time because of other comorbidities or because of other illnesses. The most common reason people get lymphedema, however, in the United States is cancer treatment. And the reason for this is there's a couple of ways your lymphatic system is damaged with cancer treatment. The first is removal of lymph nodes with a lymph node dissection. And most of us probably know that your lymph nodes are biopsied most of the time for cancer treatment because your physicians need to know whether the cancer has spread or not. So removal of lymph nodes is very, very common during cancer treatment. But what we don't often think about is also the damage to the lymphatic vessels that can happen either from surgery or from radiation. So not only the removal of lymph nodes, but the damage of those lymphatic vessels. If you remember that diagram way back at the beginning of this presentation that looked like a net throughout the entire body, imagine an area that's had radiation. Imagine how that can scar down or make those lymphatic vessels less efficient or function less appropriately. That can cause lymphatic issue, which ultimately can lead to lymphedema. Signs of lymphedema. Swelling. First signs of lymphedema can be heaviness or achiness before you even see swelling. So let's remember how I spoke about lymph nodes. Those regional groups of lymph nodes are in charge of a particular region. So if you know you've had damage or removal of lymph nodes in that region, you're at risk for lymphedema only in that region. So I'm just going to use the pelvis as an example. Let's say that you have had bladder cancer and you've had radiation to the bladder area. Your risk, if you were to get lymphedema, would be the legs, the abdomen, or the pelvic area, right? You wouldn't get lymphedema in the arm. Now, if we talk about breast cancer treatment and the removal of lymph nodes, let's say was in the right armpit, your risk for getting lymphedema would be the right arm, the right chest, or the right upper back, okay? So it really is dependent on the area of the lymphatic injury. Heaviness and achiness can be a precursor where there may be some swelling or some backup of fluid that you can't see yet, but it's there and it's making you feel some heaviness or achiness in the region. That could be a precursor, so it's something to mention to your medical oncologist or to a physician on your team if you notice that happening, okay? But swelling, clearly, if you start noticing swelling in the area that you're at risk for lymphedema, absolutely reach out to your medical team. Also, a feeling of heaviness or tightness. One example I use for this is heaviness or tightness in your hands, feeling like you can't grip quite as well because you're just feeling really stiff. That could be swelling in the hands. Again, don't ignore that. Now, we all have swelling when we've had injury to an area. So everyone has swelling during surgery and after surgery, and everyone has swelling during radiation treatment. And this swelling can last for some people up to 3 to 6 months. However, we need to be seeing that swelling slowly resolving over time. So you're going to be seeing a gradual improvement on a day-to-day basis in terms of that swelling. If you're noticing a decrease in swelling and all of a sudden that swelling increases again, possibly lymphedema, absolutely reach out to your medical team. These are some examples of where we can see lymphedema. The pictures of the arms here showing a more mild case, and this picture down here is someone who did not receive lymphedema treatment, right? So it's pretty progressed. In this picture here, you can see that there is an indention in the left breast area, not an indention in the right. So when she removed her bra, we can see that she had swelling in her left breast. Do not ignore that. And even if she didn't have breast tissue here, we would see an indention in that area. That is lymphedema in the chest. You do not necessarily just have to have lymphedema in the arm. It could present in the chest and not in the arm. And then this is a picture of someone who's been dealing with head and neck cancer treatment. And we've got some lymphedema in the head and neck area here, and then the leg. Okay, so just some examples of backup of lymphatic fluid because of injury. As I mentioned earlier, the most common cause of lymphedema in the United States is cancer treatment. And the greatest risk for acquiring lymphedema is the first 5 years of cancer treatment. However, do know the risk is lifelong. So I want you just in the back of your head to just be aware that this could potentially happen. And if it does, there are treatments to help reduce the swelling. Earlier intervention, earlier you get treatment, the far better the outcome is. Okay, so that's why this is really important. Prognosis. There's no cure currently, as in a medication or a surgery that completely resolves lymphedema. However, there is effective treatment. The condition without treatment can progress, so it does need to be treated. And again, earlier treatment, better prognosis. So let's talk about risk reduction practices. So you've probably heard information, may be true, may not be, in terms of what causes lymphedema, what increases your risk for getting lymphedema. And so I want to talk to you about the research, okay? Systematic reviews are important because systematic reviews take a particular subject and they look at all of the research studies that are out there on the particular subject. They look at the quality of the studies. They eliminate studies that are of poor quality. And then they look at the findings with a lot of research studies. Okay, so you're not just looking at one study, you're looking at, in this particular case, we're looking at 121 articles and 280 articles specifically on the topic of lymphedema prevention, or what causes lymphedema. And what we know, the factors that increase your risk for lymphedema, if you're looking at this here, you're probably thinking, these are not things that I can control. These are things that happen to me because of my treatment, right? So the stage of the cancer, if you are at a more advanced stage, there's going to be more aggressive treatment. That a more aggressive treatment is going to damage your lymphatics further. So increased risk for lymphedema. Inflammation and infection, people who have chronic infections, poor wound healing, that can lead to even more lymphatic compromise and can increase people's risk for getting lymphedema. Obviously, the number of lymph nodes that were dissected. That's why surgeons try to remove as few lymph nodes as possible, biopsy those, check those out, and then if they are positive, then remove more. Really trying to minimize the impact of how many lymph nodes need to be removed. And then radiation, not only the location of the radiation, but the intensity of the radiation can impact whether someone is at increased risk for lymphedema. However, there are some people, let's say one person had the exact same type of treatment as another person. One person may get lymphedema, one person may not. So there are a lot of other factors that we do not truly understand yet that make some people acquire lymphedema and others don't. How to decrease your risk? One really important thing is managing your weight. This again will be discussed further in the nutrition seminar. However, we know that people who are more obese or closer to obesity have an increased risk for getting lymphedema. This will be discussed in another presentation, but I do want you to know that this is an important factor in terms of lymphedema risk. Exercise. Exercise is important for your lymphatic system. So one of the myths that you may have heard is that if you're at risk for lymphedema, or if you have lymphedema, you shouldn't be lifting weights, you shouldn't be moving very much, you should baby that area of swelling, and that's absolutely incorrect. Remember that muscle pump we talked about, imperative to promote a healthy lymphatic system. And if you have lymphedema, you need to be exercising, and strength training is really important and really good for you. Do know that slow and progressive strength training does not increase your risk for lymphedema, and it does not increase swelling when you have lymphedema, as long as you're progressing gently and you're progressing slowly. If you have lymphedema, you should always wear a compression garment, which your lymphedema therapist will have helped you acquire when you're exercising. And resistance exercises such as weight training or TheraBands, exercises like that have been shown in some studies to actually decrease swelling in people who have stable lymphedema. It is a general recommendation that you increase your repetitions first before you increase the weight and resistance. So as an example, let's say that you're doing bicep curls. Remember, this is in the area where you have lymphedema or you're at risk for getting lymphedema. So let's say bicep curls, you start with 1 set of 8. Doing really great with that, no problem whatsoever. You go to 2 sets of 8. Then you go to 3 sets of 8. If you're still feeling great with that, you don't have excessive muscle soreness, you are ready to increase your weight or your resistance. So you're going to increase your reps first, then you'll increase your weight. It's a gentle way to progress weight training. There's no limit to the amount of weight that you can work with strength training, as long as you're progressing gently in this manner. So this is an excellent resource right here that looks at multiple different cancer research studies in terms of health-related outcomes from cancer treatment, such as fatigue, quality of life, physical function, anxiety, depression, and lymphedema. So for the purpose of this presentation, I want you to look at the fact that there is a robust body of evidence that demonstrates that weight training or resistance exercise 2 to 3 times per week does not exacerbate lymphedema. And some studies show that it could actually potentially decrease your swelling as well. Treatment for lymphedema, like I mentioned before, it is a progressive disease if you don't treat it, but there are treatment options out there. Complete decongestive therapy is the gold standard for lymphedema treatment, and it involves these multiple different elements. First of all, education on risk management and skincare. I'm going to speak to that a little bit further, and then also we are going to have our oncology certified esthetician do a presentation as well later in our symposium today, discussing skin health. And that's the very reason we want to discuss it, is important in terms of lymphatic health. Manual lymphatic drainage, we're going to talk about that in a second. That is part of complete decongestive therapy, or the gold standard treatment of lymphedema. Compression, whether it's a compression garment that your lymphedema therapist will help you acquire, or in some cases, your lymphedema therapist will want to bandage you with multi-layered compression bandages first to help significantly eliminate the amount of swelling in the region before putting you in a compression garment. And then exercise, as we mentioned before. So skin care. The reason skincare is important, and again, Samantha is going to be speaking a lot more on this in a moment in later this morning. But we know that when there is swelling within the tissue spaces underneath the skin, we have, imagine swelling. So my skin normally is right here, and there's all the blood cells that are trying to come out and create healthy circulation and healthy skin. Now I have swelling, so my skin is moving further and further away from the vessels that are providing it with nutrients to help maintain healthy skin. So there's what we call an increased distance, diffusion distance, between that area of the outside of the skin and the area that is bringing in those nutrients for healthy skin. So what can happen? Increased risk for infection. Increased risk for infection not only because there's that increased diffusion space, but also because your lymphatic fluid has a lot of cell fragments, protein in it. And that protein, if it sits there and doesn't move out of the area, that is a perfect environment to create bacteria and create an infection. When you have swelling, it can also create cracks in the skin, which again can introduce infection. Do know signs of infection, very important. Signs of infection: pain, swelling, redness, warmth, perhaps a fever, red streaks in the area. If you are noticing these type of symptoms, you need to go to urgent care. If you have issues with your lymphatic system, then an infection can spread a bit quicker, so it needs to be addressed. Again, we're going to go into great detail about skincare in a presentation coming up. I just kind of wanted to brush the surface, if you will, on that. Manual lymphatic drainage. Manual lymphatic drainage is a very effective therapeutic technique. It's like a massage. It's not a massage, but it's similar to a massage in the fact that your lymphedema therapist will be doing a hands-on manual technique. It improves the movement or the activity of the lymphatic vessels. It also helps reroute fluid in the area that's congested, help reroute it out of that region. It has a calming effect, which is very helpful, beneficial, and patients always really love that aspect of it. It stimulates what we call lymph angiomotoricity. That lymph angiomotoricity is basically that rate of contraction of your lymphatic system. So it increases the pumping action or the pumping rate of your lymphatic system. It also helps soften tissues. So if you have a lot of lymphatic swelling, or even if you have scar tissue from surgery or scar tissue from radiation, manual lymphatic drainage can help soften the tissues. It can help promote that venous return. Remember, the lymphatics move up the body and dump into the veins. Helps stimulate that. And as an extra bonus, it can help promote pain control too. Your lymphatic therapist can teach you how to do manual lymph drainage at home. The more you do it, the better. So learning a more simplified home version of it is important to be part of your home management program as well. Compression, like I mentioned before, there's two options for compression. There's the multi-layered bandaging technique, which is what's in this picture here, which helps eliminate the most amount of swelling, and then the garments help maintain that. This multi-layered compression bandaging, it's not using ACE bandages. Some people get confused about that. They are very specific bandages that are called short stretch bandages. Short stretch bandages have a great contractibility with working pressure. So they really work effectively when you're moving your arm. So if you were to get compression bandaging, you wouldn't want to baby that arm and not move around. You would want to be active and really allow those bandages to help that pumping action of your lymphatic system. Effects of compression, obviously it helps move fluid. And like I mentioned before, it helps prevent that reaccumulation of lymphatic fluid. It helps increase reabsorption. It also helps that muscle pumping action. It helps maintain the gains made by manual lymphatic drainage. And compression can also help soften scar tissue and firm tissue from swelling as well. And then decongestive exercise. Exercise in itself. Again, we've talked about how important that is, and you're going to have opportunities throughout the symposium today to actually do some exercise, which I'm very excited about. And it's really important because it helps lymph circulation. It helps that venous return, or the dumping of the lymphatics into the venous system. It helps promote that muscle pump. It helps increase that pumping action, or that lymphangiomotoricity. Deep breathing helps stimulate that deep thoracic duct, or the deep abdominal lymphatic system as well. In terms of what exercise is most beneficial, there's no magic exercise that's beneficial. All exercise is beneficial. So I like to tell patients whatever exercise works for you and feels right for you is the exercise that you should be doing. The more diverse and varied your exercise program is, the better for your overall health. And so similar to nutrition, and the more varied your food is, the better. It's the same with movement and exercise. But if there are certain exercises that hurt you, there are plenty of other types of exercises you can potentially do. Compression pumps. Compression pumps are not a part of the gold standard treatment, complete decongestive therapy we were speaking about before. However, they can be beneficial as an adjunctive treatment option. And so your lymphedema therapist can help assess you and see which, or if a compression pump is appropriate for you. Not all compression pumps are appropriate for all types of swelling or all locations of swelling. So definitely something that you should be assessed by your therapist to figure out which type of pump is appropriate for you. This is just one example to demonstrate different types of compression pumps. And then there's what's called the Physiotouch, or the Lymphotouch, and it is a negative pressure machine. So it's like a suction device. And your lymphatic system, remember those superficial lymphatics are just right underneath the skin. And so this gentle suction device, and it is a gentle suction device, helps lift the skin and helps stimulate, not only, it helps soften any sort of firmness, scar tissue, really great with scar tissue, and also helps promote drainage, or lymphatic drainage. I really love using it on scar tissue. There are a few surgeries for lymphedema. This is not the main intention of this presentation today, but I did want to mention it. CDT, or that gold standard treatment we spoke of before with the manual lymph drainage, the exercise, and the compression, is still the first line standard of care. However, for advanced cases, there are some other options and surgical interventions out there. There's the lymphovenous anastomosis, or the LVA, and this is a technique. It's very microvascular surgery. And they basically connect lymphatic vessels to nearby veins to help reroute fluid directly from the lymphatic vessels to the veins. There's vascularized lymph node transfer, which is a lymph node transfer. So it is moving lymph nodes from one region to another region. And then there is a particular type of liposuction called suction-assisted protein lipectomy, which is for more advanced fibrotic, scarry sort of lymphedema to help remove some of the lymphatic solids and fatty deposits that can be found in later stages of lymphedema. Lymphatic surgeries are not appropriate for everybody. Surgeons are very specific as to which patients are appropriate and which patients will respond well. And that complete decongestive therapy is always a component before surgery and after surgery as well. So this has come up very recently in terms of the COVID vaccine and if you have lymphedema. So if you have lymphedema, first of all, one of the questions that people ask is, am I immunocompromised because I have lymphedema? And the answer is lymphedema itself does not mean that you're immunocompromised. Cancer treatment, perhaps you are. So that's something where I would ask your medical oncologist, are you immunocompromised? However, just the fact that you have lymphedema does not mean that you have an issue with your immune system that may make you at increased risk for increased risk for having some severe reactions. So with that in mind, where do you get the vaccine if you have had lymph nodes dissected or breast cancer treatment on one side? Definitely get the vaccine on the opposite side. However, if you've had bilateral breast cancer treatments, then you can get the vaccine in the gluteal region or the thigh. So do keep that in mind. And this is information that was supplied by the Lymphedema Support Network. And definitely you can pull it up, you can print it out, and you can take it with you when you get vaccinated to demonstrate the need to avoid the arm that you are at risk or you have lymphedema in. How do you find a certified lymphedema therapist? So CLT is what you'll see behind their names, the credential that you'll find. In order to be a certified lymphedema therapist, you have to have some other form of medical license, whether it is a physical therapist, an occupational therapist, a speech therapist, even a nurse practitioner, a physician, or a massage therapy degree. And then you get advanced certifications to become a certified lymphedema therapist. So you do need to make sure that you see someone who's qualified and does have that credentialing. And here is a list of different places that you can search in order to find a lymphedema therapist in your area. All right. Well, I would like to say thank you so much for paying attention. I know that was very didactic and that was very like school book, textbook information, but it is going to make the rest of this symposium a lot more fun because you're going to know exactly why you're doing what you're doing. And it's going to help all of that other information that you're learning that's more like, what's the word I'm trying to think of? More entertaining, first of all, but also like everyday things that you can really do to promote lymphatic system. It's really gonna help you absorb that information. So I appreciate you taking the time to sit through this, and I hope you have an amazing time with the rest of the symposium today. All right, and I'm going to be hanging around. I'm going to be answering people's questions, keeping track of the comment section. So I'll be here. You'll see me again, but have a great day, everybody.